All right, so unarguably, COVID has had many impacts over the last nearly 2 years now. While personally, I have been impacted both positively and negatively since the beginning of the pandemic. I'm going to begin with the negative. That way, we can finish off strong with hopefully something a little bit positive. I'm going to focus my kind of the negative portion of this discussion on anxiety, as it's something that personally I have dealt with, and I feel it's important to share our experiences with mental illness, just as a way to do our part to reduce the stigma. So, during an emergency or stressful situation, anybody has the potential to experience anxiety, or those suffering from an anxiety disorder definitely could have heightened feelings of anxiety and less manageable symptoms in response. So, whether you're someone who just experiences anxiety from time to time or someone who suffers from an anxiety disorder, the basics are similar. So, it can be characterized greatly by excessive worrying, fear, and feelings of dread. And there are also triggers associated with having those responses or those thoughts. So, triggers can be very specific and based on individual experience or trauma, but more largely speaking, general triggers could include things like schoolwork stress or work stress, change, whether it be good or bad, and fear of the unknown. And that's where COVID kind of comes into play. So, as we know, the state of the pandemic changes daily. Well, personally seems as though it changes by the minute, but this poses a challenge to those with anxiety disorders or even those who just experience anxiety because of this unknown future. We have no idea what it holds. Every day things change, restrictions change, forcing us to change the way that we live our lives. I mean, just think about the many changes just for school that we've experienced due to COVID. And this virus also seems to be getting a lot closer to home, and the fear of you or your loved ones getting ill is becoming a very real reality in New Brunswick with the rise in cases. I know personally I have fears and worry greatly about the health of my family, and I therefore, um, we in my family, we take whatever precautions necessary in an attempt to preserve our health. However, we all know that sometimes the precautions are not good enough to avoid this illness. So it makes it very easy for those with anxiety or other mental health conditions to withdraw and stay home where it's deemed safe and try to control what little we can. So, this feeling of lacking in control and inability to project the future or know what's coming and be able to prepare for that, and fear of illness for you or your family, they're all very real worries of those suffering from anxiety. And as the COVID situation is turning more grave in New Brunswick, the anxiety for many will only continue to be heightened, despite effective coping mechanisms that those suffering may have in place. Regardless of those, I mean, your level of anxiety is still going to heighten, and hopefully, you do have effective things to manage it, but it certainly doesn't make it disappear. Not only is anxiety heightened because of COVID itself, seeking treatment or help for anxiety or mental health has become more challenging than ever. Restrictions have made in person appointments with healthcare providers a near fairy tale, especially for things that are decided to be non essential and can be done virtually. And there are issues for many people about accessing virtual appointments. So, things like lack of technology, lack of privacy at home, uncomfortable utilizing technology for things like therapy sessions, so treatment and psychotherapy are challenging to access in this province, even on a good day. But COVID has certainly added more obstacles in maintaining a mental health routine. Now that I have covered a few of the negative points, I think it's time to dive into something a little bit more positive. So, at first, I had a hard time trying to think of this because lately it's seen that COVID has only had negative implications on my life personally. So, I turned to the internet, as one does. So I discovered this rather interesting article that was released by the Washington Post that shared stories of multiple people whose they claimed their mental health actually improved during the pandemic. So many of them shared the same reasons as to why they felt the situation that COVID put them in improved their mental health overall. So things like decrease in demands from friends during isolation requirements, no work stress as their companies closed during the lockdowns. They're able to establish a routine with time to incorporate healthy meal prep and exercise. So they established a bit of a better balance in their life. They had the ability to live a quiet, peaceful life with the people that they live with and love. As much as COVID has disrupted our lives in a not so pleasant way, this made me reflect on my own experiences during the pandemic. And if I could relate to anything positive, something I identified with, which we learned in class, is key to maintaining mental health is the importance of self care. During the initial lockdown in the spring of 2020, I was out of work and was at home with nothing but free time to devote to either being sad and depressed because we were locked down, or what I tried to do is devote it to making myself happy. So I picked up a positive coping mechanism during lockdown, which was journaling. I was able to regulate a better balance of like me time. I didn't have work to balance at the time, so that made it easy. Um, but between me time and then also time for my friends, I would FaceTime my friends when it was convenient and beneficial for me and the person I was talking to. It wasn't out of a feeling of like routine or convenience. We were talking because we wanted to, and because we had the time, we had the mental energy. So it was easier to establish that balance because your schedule wasn't so tight. Having the time to focus on yourself during lockdown, although to some can feel isolating, and I think to everybody at one point or another, it felt isolating. When looked at through a different lens, it's the perfect opportunity to focus on growth, reflect on yourself, and dedicate that time to self care that perhaps um, had been neglected the last little while. Because it's really easy to get caught up in work routines, stress, family, what have you. um, so it was the perfect opportunity to kind of catch up and really focus on that self-care, maybe revamp some coping mechanisms and refocus on what it is exactly that you're working toward in your life, reset your priorities, that type of thing. A resource that I found in my research that I felt could help someone that was struggling with anxiety, or any mental illness really during this pandemic is a website called Bridge the Gap, and it's gap spelt with two P's. To be honest, I lost track of time scrolling through all the resources and information available on this website. So when you first open the website, you start off by choosing your province. Um, and then it gives you resources specific to where you live. So by simply clicking on, well, first New Brunswick and then Zone 3 Fredericton, it automatically brought up a large list of phone numbers and facilities within this region. Some examples include the Capital Region Mental Health and Addictions Association, located in the Victoria Health Center, with the phone number to that. The number for the Chemo Helpline, Emergency Mental Health Services Fredericton, which is located on Priestman Street, and the Kids Help phone number, to just name a few. Not just that, but there's also educational resources under the tab Knowledge Center, where there's 20 plus tabs. Some label things like anxiety, identity and self esteem, mental illness, and many others. So if you saw something there that kind of resonated with you, or maybe you wanted to learn a little bit more about, click on that tab. It brings up loads of information about it. There's another tab labeled Get Inspired, and it has things like coping mechanisms, music, books. And lastly, there was a toolbox section that has games, physical activity ideas, wellness apps, and more. Guaranteed, there are so many more things that I'm missing that this website has, but this is just what information I collected in my evening scroll that I took on it. So not to mention, there's also a whole other side of this website that's made entirely for kids, and it's, believe it or not, even easier to navigate. And the information is presented in a way that kids can understand if they were to sit and scroll on that website independently. Um, this website too can be found simply by typing in just Bridge the Gap on Google, and like I said, gap is spelled with two P's. It's all one word. Um, and I feel it could support anybody struggling with mental illness for any reason. This website could be beneficial to someone struggling with mental health in general, as I said, and definitely as a result of COVID, as it's just a large network of resources and support that could lead someone who's struggling to resources that could help them, especially where it's not as easy to just walk into a doctor's office right now or make an appointment with a physician. We're short on physicians, we're short on healthcare providers, but this is something that we can do at home. um, take a little bit of accountability and independence and research for ourselves. Um, so, if nothing else, using the educational aspect of this website to discover more about what somebody may be struggling with, what's normal, what they can do to reduce stress or unpleasant signs and symptoms of what they're struggling with, or even, like I said, contact numbers of facilities that could offer more extensive help if required. As somebody who has had past struggles, having all these resources just all in one place, in an easy to navigate fashion makes it so much easier to find help. Which, when your mental health is struggling, it's hard to put in the effort to help yourself, which we discussed. But it's a really important, essential step that we make that first step for ourselves and bridge the gap where it just has everything all together. It makes that first step a lot easier for those that are struggling.